your worth as a human being and your worth as a mother and your worth as somebody who deserves the same treatment as any other patient who walks into the hospital is not dependent on your size. Hello to all of you beautiful birthing people out there. Everybody is looking absolutely chef's kiss tonight, or today, or whenever you're watching this. My name is Elizabeth, also known as Nurse Zabe here on YouTube and Instagram. I am a certified childbirth educator and a labor and delivery nurse. And today I want to talk with you guys about 10 things I want plus size or bigger mamas to know. So go ahead and stay tuned. This is a topic that I get requested quite often, and one that I was a little bit hesitant to speak on because I am not plus size, and so I never wanted anybody to feel like, well, how can you speak on that? You're not plus size. But I am hopeful that this video will just give you a little bit of perspective and some things to look out for, and I definitely would encourage any moms who are plus size to comment down below with any other tips that you might share, with the understanding that I am going to continue to listen to you guys and get more recommendations from you as well. And I really encourage the comment section to be a place where we do some really great discussion. So I think first and foremost, and I wish that it didn't have to be said, but it does, your worth as a human being and your worth as a mother and your worth as somebody who deserves the same treatment as any other patient who walks into the hospital is not dependent on your size. And I am so sorry for any of you beautiful birthing people who have felt otherwise. Because for some reason, despite all of the progress that we are working on making and making sure that our care is culturally diverse and culturally competent, and we still have a long way to go on all that as well, seems like one of the last things that we've really tackled is how we treat people who are of a larger size, people who are on the obese or overweight categories in our BMI chart. And you're so much more than your weight, obviously, and that goes without being said. But when you come into a healthcare setting, sometimes that's all you feel like people are commenting and noticing on. And I'm really sorry, and that's not how it should be. And there is a way to address your weight and your size and things that we can do to help make the laboring better for you and more conducive for you without being hurtful and mean. And so I really encourage you, if you've had healthcare providers make comments, that if you don't feel comfortable telling them that what they're saying is not kind, that you talk with either a patient care representative or somebody where you can let them know what you experience so that we can work on making your stay and your hospital experience and your pregnancy experience better. Now, from that, I know when all of us go to the hospital, we see this beautiful chart right here where it's basically like, okay, this is how much weight you can gain if you're underweight based on your BMI. This is how much weight you can gain if you're overweight based on your BMI. This is how much weight you can gain if you're obese based on your BMI. And we give you this sheet and we say, okay, figure it out. That's not right either, right? We need to be working and having a conversation and figuring out tools and strategies to help our patients meet these goals that often seem unrealistic and unreasonable. So really, when you go to your first appointment and you're given this sheet, if resources aren't being given to you, ask for resources. Say, hey, I see this sheet. I want to be healthy. I want a healthy pregnancy. I want to do everything that I can. Can you refer me to a dietitian? Could you refer me to some sort of personal trainer or help me figure out a plan for that? Because simply telling somebody, okay, you can gain weight in your pregnancy, figure it out, not helpful and not conducive with forming a relationship where you felt like you're being heard as the patient, which is so, so, so important. We do know that being heavier, that adipose tissue in and of itself can excrete hormones that puts us more at risk for preeclampsia, for gestational diabetes. And ideally, we would be working on fitness goals and figuring out a plan that's best for us that makes us happiest and healthiest before pregnancy. But if you're coming into pregnancy and you haven't figured out those goals yet, figuring those out in early pregnancy with the help of your provider and other care providers is going to be really important for you to have a really strong and healthy pregnancy and for you to feel good in your pregnancy. And that is so important. One thing that I recommend to all of my pregnant mamas, anybody who comes through any of my childbirth education classes that I teach at the hospital where I work, is getting up and walking 30 minutes a day. We know that this is so great for your cardiovascular health and even great for the cardiovascular health of your baby. And also, what we know is that our sedentary lifestyle and the positions that we often are in when we're driving a car, when we're leaning back and watching a movie, are not super conducive with making room for baby to get in the best position for a physiological birth. So being upright and moving and walking 30 minutes a day can do great things and can prepare you for the stamina that you're going to need during labor. Another thing to consider when you're coming into the hospital is that if you are upright and moving during your labor, those things can help our babies get into a better position, and you can hopefully use some intermittent monitoring. Sometimes when we have more adipose tissue on our abdomen, we can have a difficult time tracing the fetal heart rate and keeping our contractions on the monitor, which might be necessary if you have an epidural or if you have an induction or an augmentation of labor with Pitocin or with any sort of cervical ripening agent. But that doesn't mean that we shouldn't still be up and moving. There are a lot of things that your nurse can do to help keep your baby on the monitor. We have a lot of tips and tricks and things that we can do to help trace your contractions and help trace your baby. Even if that's us hanging out in the room with you and holding the monitor on. That's something that we can do if that needs to happen. But also, being upright and moving and not having an epidural, we can just use our intermittent monitoring in most facilities, which can be really, really beneficial as well. If you have the straps of the monitor on your stomach and they're starting to hurt your back, let your nurse know. Often these get tighter and tighter and start to dig, and where they sit on most women is where we kind of have an indentation right on above our hips and really start to dig. We can always take a pillowcase or a sheet and place that in between the monitors and your skin to help that irritation stop happening for you. So one thing to consider as well, if we are having trouble tracing the baby's heart rate or tracing your contraction pattern, and we need to have both of those on the monitor for whatever reason, whether we are artificially augmenting your labor, one thing that they might consider using are internal monitors. So a fetal scalp electrode, which is a little electrode that's going to sit right on your baby's head and be ever so slightly, it's almost like a little screw, which I know sounds scary, but picture it more like when we were like young in elementary school and you take a safety pin and just put it right under the skin in your hand, where it wasn't actually piercing the skin and being super painful. It's kind of like that. It sits on your baby's head and gives us a really accurate tracing of their heart rate. And a intrauterine pressure catheter is something that we can use. It is a catheter that is going to sit inside of your uterus and actually tell us the strength of your contractions, how frequently you're having them, and how often you're having them. And both of those might be beneficial or useful if we are having difficulty monitoring your baby as well. Both of those require that your water is broken. They can increase our risk for infection. So neither one of those are things that we're going to use lightly without trying all of our other tricks to keep baby and contractions on the monitor. We've talked about how being obese or overweight does put you at a slightly higher risk for gestational diabetes. Having uncontrolled gestational diabetes does put you at a higher risk for having a larger baby. But simply being a plus size woman, whether you are categorized as overweight or obese, does not mean that you are going to have a large baby. It doesn't. Now, if for whatever reason you do end up with a cesarean birth, one thing that I think is really important for us to remember postpartum is that we want to make sure that that incision stays nice and dry. Sometimes that incision is going to sit underneath your stomach in something that we refer to in the medical community as a pannus. So making sure that you're lifting up your stomach and getting that area really nice and dry with a towel. It also can be really beneficial to use a hairdryer and dry it off. That can work really well as well. And then something else that might be beneficial as well is actually having somebody take a picture of your incision, because you're going to have a hard time seeing it in the mirror. And that way you can monitor it if there are any changes in how it's closing up, any changes in the coloring of the skin around it, any changes in any sort of discharge that you might be experiencing from your incision. In most of your standard labor kits, we give you a pair of mesh underwear. They actually aren't that big, so go ahead, and if you are thinking that they might be too small for you, you can call the unit ahead of time and make sure that they have larger underwear, or you also can bring a few pairs of large, I would bring like granny panty style underwear that you don't mind getting ruined. Buy like a pack of some cheap Hanes ones to have on hand, just to make sure that you have underwear that fit and feel comfortable for you that you don't want to ruin. Often I have seen women who are breastfeeding with larger breasts have a harder time managing the size of their breasts. There are a few things that we can do to really help with that. So if your breasts are larger and kind of the nipple almost faces downward, which is really normal with larger breasts, what you can do is you can either use, I have one right here for demonstration purposes, a washcloth or even potentially a towel just based on the size of your breast, and roll that up and place it up underneath your breast, and now all of a sudden our nipple is pointed forward. It's much easier for mom to visualize when latching baby. One position that I see a lot of moms really enjoy if they have larger breasts is the football position, where baby's tucked alongside of you like a little football. And breastfeeding, a lot of women are afraid that the size of their breast is going to suffocate their baby, but if a baby is latched correctly, their head is actually tipped back a little bit, and they're gonna have area on the side of their noses, their little sweet little pug noses that go up just a smidge, to breathe. But if you're ever concerned and you feel like you need to hold your breast back, you are more than welcome to do that. You just want to make sure you're not holding it back in such a way where you are pulling nipple out of the baby's mouth and creating a shallow, painful latch, or making baby unlatched totally. Okay, so I hope that that was helpful for you guys. Definitely, if you have any questions or comments or things that you thought I forgot, leave them down below. I think that the comment section is going to be a really great place for us to have a great conversation. Thanks so much. Bye, guys.